Good afternoon. Thanks for being here. My name is Bjorn. I'm the CEO of Plasmacure. I'm going to talk to you about wound care. Every 30 seconds in the Western world, someone uses a limb because of a wound that got infected, never healed, got infected, and ultimately led to an amputation. 10 to 20% or 10 to 15% of elderly suffer from chronic wounds. A chronic wound, the definition is a bit inconsistent, but typically is a wound that starts and doesn't heal for a prolonged period of time. So for example, for an elderly, someone who is, let's say, at age, has diabetes, something that may start as a small wound is treated through the normal standard of care. Once or twice a week, that person visits a clinic or is visited. The wound just doesn't heal, becomes larger, and has a huge impact on that person's life. We've heard in many rooms today about Medtech needs to be about what matters, what influences people's lives. This is what Medtech is about. It's not only a huge impact on people's lives, it's also terribly expensive. 2 to 4% of healthcare costs go to wounds, and a large proportion of that goes to chronic wounds. This makes up a global market of about 70 billion a year. Now, if you look at the standard of care, the existing practices in wound care, they've not changed since the last decades. We're talking about super traditional, hard debridements, dressings. Big companies making lots of money have invested interest in this space. But actually, if you look at the clinical data associated to these technologies or to these solutions, there's hardly any compelling clinical evidence. So 2 to 4% of healthcare costs comes with hardly any clinical underpinning. Our company, Plasmacure, brings technology to this space. Called plasma technology, I'll talk about it in a minute. But we intend to, let's say, bring innovation in a way that works with how the industry currently works with how people currently work, rather than revolutionizing every dimension of it. Our solution is proven safe and effective. This is the result of a recently completed RCT that shows that in the Netherlands, gold standard of care, which is sharp debridement plus dressing twice a week, that closes 25% of chronic wounds. Cold plasma technology or PLASOMA solution, which is our solution, closes 62% of wounds. That's a huge impact. A huge impact to that person's life, but also to the system. If you cut off the long tail of care, not having to go to that patient twice a week, or the patient not having to visit the clinic twice a week, you can save between 40 and 50% of that huge amount of cost in the healthcare system associated to wounds. Perhaps even more important, you can save labor associated. You can make people more productive and thereby get rid of some of the long waiting lists that I think you can find across the world in every healthcare system. More than 50% of productivity improvement from using Plasmacure or using the PLASOMA solution. So what is plasma? Not to be confused with blood plasma. Plasma is also sometimes referred to as a fourth state of matter, and you create it by sending a lot of energy into gas. It ionizes the gas, and it's perfectly familiar concept, both in the medical space as well as in nature. Lightning is a plasma, the sun obviously is a hot plasma. What happens? If you send energy into a gas, the gas basically breaks apart into particles, or we call reactive species. And if you do that with atmospheric air, you create reactive species that have a proven conducive effect on wound cleaning and wound healing. If you go a little bit more into detail, on the left you see the cleaning bits. Cold plasma kills bacteria instantly. You send plasma into a bacteria colony, it's instantly dead. More than that, it also breaks the biofilm. Proven effects in medical science. It also stimulates the healing process by driving cell proliferation, but also improving microcirculation. And every dermatologist or any wound specialist will know that these are the underlying principles of wound healing. Now, how does it work? Schematically, we put a a patch on the wound. We drive a high current, a high voltage to the wound, 6,000 volts. Sounds very high, but very low amps, so not super dangerous, not dangerous at all, in fact. Under the patch, there's cavities, let's say. We ionize the air in the cavities of the patch. We create small lightnings, and we create those reactive species which do their job not only during the treatment, which is a 2-minute treatment, but also, let's say, hours after the treatment. The solution consists of 2 components. First, you need a unit, a pulsar unit we call it, to create the plasma. That's the thing on top. That drives the current to the wound through a wire, basically. Then you have something on the wound, which is closed over the wound, so you capture the plasma, and that's called the cold plasma pad. That's basically the consumable in this model. Every treatment with cold plasma pads goes around 125 euros, and you require about 10 to 15 treatments to close a wound. You may recollect from the chart I was showing you earlier. We have patents, strong patent position files, and granted both in the US and in Europe. Now, there are other companies that offer cold plasma, and that's good because it's an up-and-coming technology, and it would be quite scary if we would be the only person advocating this new technology. What is unique about PLASOMA, about Plasmacure, is the fact that we are proven safe and effective with a technology that can be used both in the clinic and in the home. And that's because quite early on, there were some really smart design choices made by the team. Plasoma therapy is portable. You can just carry it on your back in a backpack. It's very simple to use. There's lots of Philips people in the team. So these are typical Philips design principle. One button, and all the intelligence is hidden in the technology, in the electronics of the solution. But also, the treatment itself is a 2-minute treatment only. So it can easily be integrated into the regular care, the standard care, and also the actual physical movements, the practices of applying plasoma treatments are very consistent with the way a nurse would treat a wound nowadays. So that's why I was mentioning earlier, we will revolutionize wound care with technology, but applied in a way that is very intuitive to the players in the system. We are from the Netherlands, you can tell by my accent maybe. This is our home market, and we're starting to make commercial traction. That means that we have care institutions that say we want to work with Plasoma, but also insurers that say, you guys are going to save us a lot of costs, let's go and partner. More importantly, the government has also given us a grant, and a grant will take us to a reimbursed state, the fastest path in the Netherlands. So that's great vote of confidence. We're also focused on China. We have a strong partner, the strongest wound care partner in the Chinese market that believes in our technology, is allocating 2 to 3 million euros to take our technology to reimbursement. And it's through a so-called Hainan route. We believe we can be reimbursed in China in 2026. And we have some operations, pilots going on in other selected markets like South Africa, Middle East, and we're getting interest from other markets as well. We're currently raising about 4 million euros. About 1 million of that is covered by existing shareholders. That money is basically going to the commercial acceleration of the business. A little bit still in feature development, but I would say the technology is mature. We've invested over the years quite substantially behind technology, behind clinical evidence. I was showing you earlier, there's more where that came from. And we believe we're ready to, in fact, scale commercially. And we're looking for partners that want to join us on the journey. We've said the US is a very interesting market as well, obviously a large market, but one that we believe the regulatory path will be able to navigate. What we consider to be more complicated is the go-to-market, how we're going to make money. So we're looking also for the right partners to help us navigate that. That's it, and this is a letter from my lawyer. Thank you.